Hi, my name is Joan Morgan. I'm a patient and family education consultant at Cincinnati Children's Hospital. And we did a project that was geared toward patients and families who either were non-English speaking, who had never navigated through the healthcare system, or who had limited literacy skills. And what we recognized in the hospital was that these patients and families had a difficult time understanding when we just used verbal explanations. And we did a process improvement project based around using pictures to help explain medical procedures. What we found was when we identified and used plain language along with the picture tool that it jumped up to 4.8 out of the 5 steps, which was over 60% increase in that knowledge transfer. Since we had validated that the pictures actually worked, we asked patients and families to identify what types of things that they had difficulty in getting across to our staff. And we also asked staff what were the most difficult concepts for them to explain to patients and families. So what they did, we came up with a picture toolbook that has a whole host of pictures. So we have different sections called Caring for You, Keeping You Safe, Eating and Drinking, which has NPO instructions, lab work and IVs, supplies, isolation, which has all the different pictures of different types of isolation that the family may see of people walking into the room, and then peoples and places that they might see within the organization. So if I scroll through, this is a blood pressure, getting their blood pressure done. We have this one that shows when we say to a parent that they're going to have their child's going to be placed on a monitor. That doesn't really mean much. So we show them these pictures that actually shows them they're not going to sit on a monitor, but we're going to put leads on, little stickies, and then it's going to look at how their heart functions. So it goes all the way through. We have lots of different pictures and tools. So what our organization has done is we've placed these as ebooks on iPads that are used by our interpreters, our child life staff, and our nursing staff, as well as we have hard copies that we provide to patients and families who are not English speaking. And then we are working with the Get Well Network to actually place this on our patient interactive care system so that it would be available on their TVs.